is the important issue in the human body that makes red blood cells, white blood cells, and platelets. Mostly, they will found the center of the marrow and is functioning the essential to live. A bone marrow transplant, also called a stem cell transplant. Dr. Sudhet Hong Ing, the chef of hematologic disease, pediatric oncology, and bone marrow transplant, will explain.
The bone marrow transplant basically is a curative disease for the thalassemia. Actually, other than the thalassemia, it's a procedure to cure the other disease as well, like leukemia and bone marrow failure, like aplastic anemia. So aplastic anemia is a disease of no marrow doesn't have any function. Since in case of leukemia, its marrow is full of malignancy, blood cells, of blood leukemia. And the other one, the thalassemia that you mentioned about, it's some kind of like a genetic disease, like a hematopoietic stem cell or blood stem cells that produce the abnormal red cell. Thalassemia is a genetic disease, and usually it's inherited from father and mother, and so and then the patient suffer with the anemia, the chronic anemia, and require the blood transfusion the rest of the life. So the way how we're going to cure thalassemia is only one thing: is a stem cell transplant or bone marrow transplant, and then the stem cells, since the patient their own stem cell is abnormal, so that's why we need the stem cell from the other people, and basically we use a stem cell from a sibling and or wife sibling because we need the stem cell that have HLA matching. HLA matching is different from the blood group. It's another thing. It's some kind of tissue antigen, and you have to be matched. And the chance of matching of HLA is it stands for histocompatibility or human leukocyte antigen. So the way how we test the HLA, we just draw the blood and we check the antigen of the cells of the donor and the recipient. Recipient is the patient. So usually the potential candidate donor for the stem cell donate to the patient, it's sibling. Why sibling? Because the siblings share the HLA matching between siblings, but the chance of HLA matching between siblings is only 25%. So that's why in some case or some family, if the patient is only one member, only one child in the family, there's no sibling. So how we gonna get the stem cell? So or even the patient have the sibling and the HLA doesn't match. So what we're gonna do? So we can find the stem cell from the other people, like from stem cell from the Thai Red Cross. Usually Thai Red Cross, we have a donor registry for the stem cell donor registry. As I think you know already that right now the Thai Red Cross kind of have a service to have a donor registry, and then right now we have the donor registry in Thailand for the Thai Red Cross around 200,000 donor, but the chance of the matching is only around 40%. So the third thing, that the way how we're gonna get the stem cell in case of no sibling or no match and unrelated from the donor or from the Thai Red Cross, maybe we can get from father or mother, which is some kind of a very difficult procedure. In the most difficult cases in the transplant, if the patient have a sibling to do the transplant, it's fine, we can do that. But the chance of cure right now, the match related or match sibling, to get the stem cell from the sibling and do the stem cell transplant or the bone marrow transplantation, so the chance of cure is almost 90 something or 100%.
Wow.
So right now the technology of the bone marrow transplant is advanced. So the risk of fail of the patient, the death rate of the procedure is very minimal at the moment. So this is a stem cell, hematopoietic stem cell. So the DNA from the blood is changed. However, the other cells of the body is not changed because we just change or transplant of only the stem cell. So the other organ, like a skin or heart or whatever, it still belongs to the patient. Just only the hematopoietic stem cells or the bone marrow stem cell that change. So make a long story short, or in summary, the way how we're gonna cure the thalassemia, which is abnormal of the genetic of the gene, it's a genetic disease. So we have to find the stem cell from the other because the patient their own stem cell it's abnormal, and the way how we're gonna get the stem cell or the bone marrow from the other people is from the sibling, and the sibling must have the HLA matching. So this is the way how we're gonna cure the thalassemia.
Mostly about 70% of patients who needs a bone marrow transplant didn't find one in the family members, and over 60.000 have waited for the match HLA, but the odds 1 in a million of finding a match in general populations. Everyone needs to sign up today. You can give the gift of life.